Okay, you can start now.
Good morning, all the listeners and viewers. Today we have Dr. Manoj Abraham with us. Sir is professor and principal at KG College of Physiotherapy, Coimbatore. He is PhD guide at Dr. MGR University, Chennai. Sir is DRC member of MGR University and Wells University, Chennai. He is PhD thesis examiner for various university and Sir is ethical committee member for Savita College. Sir is institutional review board member and chairperson for the Savita University. He is also PhD committee advisor for various university. Sir is also member of the Center for Research on Non-Communicable Diseases and UG Research Project at Thanku Abdul Rahman University, Malaysia. Sir is serving as reviewer in various research journals like Journal of Biomedical Education and International Journal of Medical and Exercise Science. He is editorial board member for Journal of Rehabilitation Research and International Journal of Therapy and Rehabilitation Research. So we have very eminent speaker with us who can enlighten us on today's topic. So I hope the session will be very knowledgeable and fruitful for every listener. So over to you, sir. Thank you. Yes, Manoj, sir, you can start.
Yes, okay. Is it okay? Clear?
Yes, sir. Yes,
Yeah.
sir.
First, at the outset, I would like to thank Parallel University and Bhavana Madam in person for this opportunity and where I could come and share my knowledge on how to write a research article. And to Dr. Chaitali for coordinating this entire thing. I will start sharing my screen now.
Yes, sir.
Are you able to view my screen?
It is visible, perfectly okay, sir.
Fine, okay. So I'm working as Saitali had said, I'm working as a professor and principal in KG College of Physiotherapy in Coimbatore. Many people wanted to want to know about how to write a article and what all the other things are. So my idea for today is many people have heard about review article and other things. So today I'm going to share on how we can do it. So we will stick on to these three headings on what is a review article, what you do, and why you do it, and how you can do it. So this is how I would cover. Now coming on to what is a systematic review. Okay, so just some basic knowledge on that is systematic review is always is defined as a synthesis of analysis. So what you do is that you get data which has already been published, so it's not something which you create new. So you try to get data or whatever has been done before, and you try to get the idea about it. Okay, and this is also used, okay, so that you can come up with a new conclusion. And okay, now I will tell you that why you need to do it later on, so just stick on to this. Okay, and the third one is this is not a new concept. So this dates back to the 20th century from which we are doing this review. I want you all to see this from Science Direct. This is from the journal Physical Therapy in Sports journal. There is a topic here is the effect of supervised physiotherapy versus home exercise program in patients with acromial impingement syndrome. This is a systematic review and a meta-analysis. So they've done this. So as I said, you can come to a conclusion to find out what it is. So this study highlighted that we always have that notion, isn't it? Supervised physiotherapy is a better choice or the first choice of treatment. But in this study, they did a meta-analysis, they did a systematic review and then a meta-analysis, and they found out that supervised physiotherapy and home exercise program have similar effects So this gives you a better idea in your planning or taking care of your patients. So this is what happens when you talk about it. Now this gives you a deeper understanding. Okay, so now we know. Okay, so now we know that it is already established. You get established data which you can follow. So this is the synthesis of knowledge which you normally do, and this synthesis of knowledge in a systematic review has to be done in a clear and a precise manner. So today I will be sharing on how to do it also, mainly the basics. And this requires you need certain specific skills and competencies to do this. There are a lot of terms, okay, which can be used, like research synthesis, systematic review, and all that. So we will be understanding what it is. Okay. So now we are sticking only to systematic review. So the systematic review, they have a strict assessment criteria. Okay. So not many people will understand like what is the normal criteria. So I will be teaching you with examples on how it can be done. Okay. So now this systematic review also helps you to identify gaps in research. So far we always think that only doing an RCT, a clinical trial, or doing a clinical trial examination or a research work is only there to find out the gap. But even a systematic review can be used to find out a gap. I'll give you an example. When you do combined group and home exercise program in community dwellers, fall risk among older adults. This is a study, and it was a systematic review. So the abstract, when you see the abstract, the objective where they wanted to see whether that combined group and home exercise program in community dwellers had any effect or not. So the conclusion was very interesting. They said that the group exercise with the home program had better functional outcomes, was one. But it also gave idea to the further research, where they said that research is needed to identify behavior change techniques and to improve adherence to exercise. So this again gives you another perspective. It is not only your clinical, your regular research work, or your clinical RCT or non-RCT which is going to give, but even a systematic review also can give you a change to identify a newer research gap and then start working on that. Now, just some base, whenever you read about something, you need to know the history of how it started and the other things. So coming on to the history of this systematic review, I just thought, so the first clinical trial in physical therapy was done in 1929. Okay, and 1931 it was the 2 years it was published, and it was done on UVR, which for school children, okay, with respiratory problem. And then when you read about it, then we see that the first systematic review in the physiotherapy was done where the effects of treatment on ankle injuries, it was done in 1975. So you see there is nearly a 50 years of people who have been doing on systematic review also. And there is an exponential growth in this. So I'll just show you this graph. Previously, and this is from the British Journal of Sports Medicine. The publication starts from 1930s to 2010. This is the data I had. You see that many people started doing RCTs. There was a sudden hike after 1980s, 90s. There's a hike. Whereas when you see the graph, the blue line also shows that the systematic reviews also, many people started doing that. So systematic reviews also after 1990s, 2000 and all, 2010, there's a sudden hike when compared to the clinical practical guidelines. So now this leads to the question that why so many people are doing systematic review. And before I could talk about that, I just want to clear a small confusion in the terms. Many people interchangeably use the term meta-analysis and systematic review, but that is not correct. Okay. So systematic review can be done with or without a meta-analysis. That is the baseline you all should understand. And the second is the systematic review aims to minimize bias. Okay, that is what we do. The statistical method, okay, which to use to integrate the results of these studies is called as a meta-analysis. So this is the basic difference. Systematic review is what you are trying to do data analysis, like you are trying to find out from all the studies what has been done. And if you are doing you integrate the results and trying to do a statistical analysis of all those results, that is called as a meta-analysis. Now many people get confused. I don't know how many of you all are confused today also. We always think that what is the difference between all do studies? There is something called as literature review and this is a systematic review. So what is the major difference? This is a basic question everyone asks. So first and foremost is the definitions. Okay, so when you see the systematic review, it is a high level overview, whereas the literature review is a qualitative summary of evidence which you do. Okay, so here you try to answer a question in systematic review. Over there, you try to come up with a summary to provide to get a topic. And there are certain guidelines is the major which you normally have. The most common thing here is when you do systematic review, it has it has a certain protocols and certain norms to follow, whereas literature review is just general, okay, or some specific questions which we have. When you look at a systematic review, you have a selection, same eligibility criteria to select and assessment and all that. Here you have those 5 chapters which you start writing when you do a literature review. So these are some of the basic differences which you have in systematic review and literature review. So don't get confused with these two terms. Literature review is only concerned with your topic which you are trying to do. Here it is you are trying to get high level overview. I will tell you how that has been done also. So far we are seeing, I was telling you of what systematic review is and why you need to like what is it important, and now why should you do it. Okay, now what happens is now we get so many papers, isn't it? Just give you an example here. Compared to 1991, in 2008 there are nearly 360 and 40 times more paper in Web of Science, okay, on these 3 topics which I just got randomly: malaria, obesity and biodiversity. So what happens is there is an exponential growth of papers. Okay, so everyone wants to do this. Okay, so what happens is, so when you as a practitioner or a researcher, do you have time to read through all these papers? That's a question, correct? So you won't have time to go through each and every paper and to know which is the best and to come out, other than the clinical guidelines which normally take place. So all of you all know the pyramid of evidences, isn't it? So lowermost is your expert opinion, and at the higher most is your systematic review. So now you understand the importance of systematic review. Your RCT is also lower below. So this gives the importance that the level of evidence which you are trying to do or to find out, or whatever treatment you're going to do, is based on some RCT, is a better choice. Now what happens is there are so many people writing. So if someone, the advantages is if someone the normal everyone writes to feels happy to write their own RCT and publish it, because the name of the author is cited and many people are given credit for it. But whereas when you look for the systematic review, there's not much. It is one person's job to summarize everything and give. So that is one part. So when you do a systematic review, you're making others' life easy. That's what I would say. So it has both advantages and necessary, where you need to summarize the recent literature. We are not sure that the treatment which was done 10 years before holds good even today. So there's a lot of differences. So you need to make sure that you summarize and give it so that the people can start following in their clinical practice or in their research work. So this is what means. So this is a useful and a professional way of doing it. I'll just give you the broad classification of how the review article exists. One is, I'm not going to go into it in individual. I'm just going to stick on to only our study because of the time. They are divided into based on the methodological approach. Okay, so how they approach it could be a narrative review. I think many universities and colleges are asking students to do a narrative review. Okay, it's just based on summary, based on the experiences, theoretical framework which has been done. Then best evidence reviews has been done. Then the systematic review, which we will be seeing in detailed today, which I would be sharing. Then the meta-analysis, which you normally do. This is based on the method of doing it. Then you see the review articles also are classified onto the based on the objectives. Okay, this is another type of way of doing it. That is called as the status quo review. Okay, then you have something called as the history review over the period of time, issue if there's any burning issue, and then you do a research article on that. That is called as a issue review, and a theory or a model review when you want to introduce a new concept. Okay, so that is a theory and a model review which you can do. The next type of review article you can do is by mandate, where you are called. Say, for example, invited reviews, where the experienced researchers are invited to write a review about it, or commissioned, where you are being asked by either an NGO or a government organization to write about this. That is, and there are some which is normally we write, to the review articles to the editor or something. That is their unsolicited submissions. They have an idea and they share it. Okay, now just coming on to rational. So now with this, what all you can do by doing a systematic review, we can have a informed clinical decision making. So in other words, what I'm trying to say is, when you do a systematic review, you come to an understanding of analysis of various articles, and you will come to an idea of how to treat that patient correctly. So this is, in other words, is something similar to your clinical guidelines which you normally get. Okay, to break down a bit more further for you all to understand clinical guidelines, I will just tell you a very basic example. As physiotherapists, everyone knows that the American Rheumatologist Association guidelines for to confirm whether the patient has got a RA or not. They normally say that you'd have 3 or 4 features: small joints, early morning stiffness, and symmetrical, then deformity and all that. You remember? So that is the guidelines. So based on that guidelines, you find out whether the patient has got that RA plus the other test which you normally do. Whereas here, what we do is, with the systematic review, you also find out by doing a rigorous analysis which has been done, and you give suggestions and which is the best treatment or what can be done more. So that is what is most on the informed medical decision. Then the plan future agendas. Okay, then establish clinical and health policies can be done based on this. Then you can prevent unnecessary studies. Okay, because lot of people, it is not, when you look at the data which have been done, and with now I think every university is asking you all to do some research work or the other. So now, in order to prevent that, you can start doing this. So this is one of the common studies which can help you to prevent unnecessary data studies, and possibly use for comparative effective research which can be done. So far we have started, I've just started with like what is systematic review we have seen, and why systematic review is important. Okay, because it summarizes everything and give it to us. Now how we have to do this is the most important and the crucial part. So the how I've have given the mnemonic like ABCDE for you all to remember easily in future. Okay, A is, you'll have to define a clear definition. B is a research protocol, comprehensive research strategies, do a risk of bias, and end reporting guidelines. Now let's start with the first, a clear definition and objectives. This is very common topic, isn't it? Like everyone, even in an RCT and a non-RCT, any research you would do this. Everyone would ask you to get a clear definition. So the most important what you have to do is, you have to identify the intervention on the study focus, on whom, why, on what study are you going to do. That is the most important thing, and the outcome which you do. Okay, so there are 3 items. Most important is on whom, that is the study focus, what is the intervention, what is the outcome, and what is the population of your interest while you are doing. And these 3 would give you a proper review question. So this would give you the review question. So once you get this review question, so you have to how do you develop this is by following a research protocol. Okay, now many would be thinking that the only common question in many of my students or anyone who I've met ask me, I don't know how to select a topic. That is what everyone finds. So I would recommend everyone to do something based on your interest. Okay, don't just follow whatever your guide says or your supervisor says and start doing it. So what is your interest? Okay, so you will have to see what is your interest. After based on the interest, you should have there are a lot of protocols in which you can adapt and come up with a topic. I will teach you how to do that also. One such method in which you available tools which you can do is something called as the finer criteria. Okay, you will have to see whether the topic is feasible, whether you can do or not, whether it's interesting, okay, whether it is of interest, whether it's novel, whether it is new. You cannot keep on redoing which has already been done and something, and whether it is ethical, whether like when you are treating patients, whether it's ethically appropriate or not, and relevant. So this is one of the criteria which has been used. Just asking you just to elaborate more on it is, feasible is, well, you get so many number of subjects, okay, whether you will be able to get so many subjects or so many things to do it. Interesting, like why you want to do it. Okay, now the most I think the trending topic now everyone talks is like on facial manipulation, your visceral manipulation and all that. So you see that is your topics which is being given. So try to do a study to see whether that holds good or not. Okay, then you have to see whether it's novel, that is whether previous studies have been done, and whether your input to the research is better or not required. Okay, then ethical, whether it will be approved by your ethical board, and whether it's relevant, okay, for further study. There are other helpful tools while doing a systematic review, and the most important tool which I would be elaborating today is called as the PRISMA. Okay, PRISMA. It is called the Preferred Reporting Items for Systematic Reviews and Meta-Analysis. This is one. Next one, I think everyone should be aware of the criteria called as PICO. That is population, intervention, comparison, and the outcome. That is how you select. Then there are other two. One is called as the grade, and another one is the sign which is available. I just thought I'll just highlight on the PICOT, which we normally do. So when you take a topic and you want to do it, you'll have to see whether the patient, what specific patient population you are interested. Okay, so this again you will say, so then how is this different from a regular RCT or a non-RCT? So again, I will tell you, irrespective of that, even this also needs a population in which you are interested. When you have to do it, I will give an example, you will understand it much more better. Investigations, what investigations or interventions you are looking at. Comparison, how are you going to compare, what are your outcomes and your follow-up time. This is the example we will follow for the PICO. And sorry. Okay. Now what has happened is, when you look at this PICO, so I would like, so you have an idea. So I'm just giving you an idea. Like you have a patient who has difficulty in exercising due to COPD, common obstructive pulmonary disorder. And you wonder if pursed lip breathing technique may improve their endurance. This is your idea, what you are trying to do. This is what I'm saying. So try to do a research based on your interest and not out of compulsion. So here, as for the PICO, I would like P is the population. Who we are going to do is patients with COPD. Fine. I is the intervention. What is the intervention you're going to do? It is going to be pursed lip breathing, which you're going to do. C is your comparison. You're trying to compare what pursed lip breathing with what the regular breathing, which normally which we do. Fine. Okay. And O is the outcome. What is the outcome you're trying to measure out of this? Is you have to see, you're trying to see that whether pursed lip breathing has an improvement in the endurance. So you write the PICO format, you write down, and then you can come up with a topic that in patients with COPD, does using pursed lip breathing as compared to regular breathing improve endurance? So this gives you an idea how you can use a PICO to formulate your question. And the next important, I just thought I will show you screenshots of these. So everyone is aware of the CTRI, Clinical Trial Registry of India. And anyone who does any study would always ask whether you have done your CTRI registration, whether you have a clinical trial registration number and all that. That is very well and good. Now we are talking about systematic review. So for CTRI, that is for randomized controlled trial and all that, you have a registry. Like that, if you are doing for systematic review, even that also has a registry. So this is called as the Prospero. Okay, this is in the US. It's an international organization where they have a registry for specifically systematic reviews. Okay, so I think I wanted to tell you all. So when you are planning to do a systematic review, you can register with Prospero. Okay, this is under the National Institute of Health Research in the US. You have to write down to them, and they will give you a number. The reason why I'm asking you all to do this is when you go for publication, everyone asks if you are trying to do, if you have done a clinical trial also, they will ask whether you have done a clinical trial registry or not. So here again, when you start doing this, people would understand that you have also registered, and it will be more valid when you go for your publications. So this is just one. The second one is the Crocaine database. Okay, even they have a registry for your systematic review, which you can be added. Okay, this is another important thing. Third is Campbell. So these are the three more major what you say databases which have a registry for you to register before you can do a systematic review. Okay, other than that, I just wanted to tell you there's one I don't remember the name. It is with the Hamad Medical Corporation in Qatar. They also have a database where you can register your systematic review so that it gives you a better outcome. Okay, now coming on, so far we have seen. So what you're going to do is you have thought of a plan to do a systematic review. You have come up with a topic using the PICO, okay, or the finer, whatever. So we'll stick to the PICO, which we just did. We've done the PICO and you have come with a topic name. Now you have to, then what you do after after that, you are trying to register, because without registration it won't be that good, correct? So you either register through any of the other databases which I shared for systematic review. After that is you have to start. Okay, so you have to do a comprehensive search. How you have to do? So you have to decide the inclusion and exclusion criteria of the review papers which you are going to do. So that you'll have to find out. So, and you'll have to see how they have done and the other things, and the studies on that you should you shouldn't like exclude studies just based on the language or any other risk barriers. Okay, so now what you do is you have come up with this topic, and you have to search, unlike your review where you search only in whatever articles you can get and say. Whereas when you do a systematic review, you have to do a search in all the available databases. That is the difference. Okay, I'll just give you what I mean. So first and foremost is you will have to search for your topic in all the databases. The one of the drawback we have is that there are paid databases like Embase, Sinhel, Medline, and PsycInfo. All these are paid databases, so you cannot really start getting data unless you are whether your university has got membership or paid or not. Okay, whereas normally everyone starts looking at PubMed. Actually, that's the free version of Medline, for your understanding. And there are only 14 journals that are indexed in PubMed. So when you start doing, so what you do is you just do a PubMed search, and you get a lot of data like studies, and you think that's the end. No, there are other databases. So what Cochrane recommends when you are doing a systematic review is you should have data, like you should have run and got data from either PubMed, Medline, Embase, and Cochrane Central. Okay, so these are the three basic minimum databases from which you should get your studies or your data. So this is the Medline, just for your information to see how the website looks. This is the paid version. This is from the US National Library. So if your university is in link with them, you would be able to download their papers directly online. This is the most commonly anyone doing research would be very happy only with PubMed, because this is the most easiest thing which we understand. So, and they give you a lot of data. So you just come onto the PubMed. I've just given you an example just for students to understand how you can do a study using PubMed. I've come to PubMed. I've just typed back pain and exercise. Okay, I just want to do a systematic review on that. So once I type back pain and exercises, I get nearly 6,757 results. That's quite a large number. So how can I trim this? How can I do that? I will teach you how to do that also. And again, coming on to this is there are something like you can like advanced search builders where you can always have, where you can enter terms which you have and you can get those details. This is the paid version. It's called the Embase. Again, this is by Elsevier. You'll have to have a subscription for you to download any articles which is in Embase database. This is Chin Helen. So normally they say that this is most of nursing and health professional data are in Chin Helen. So again, you need to, this is also under EBSCO. You need to have a prescription, like you have to have a monthly subscription for you to get this. And EBSCO Health, this is another database, and to say that this database is much more beneficial for us because they have a lot of papers and thing on rehabilitation or physical therapy from which you can get. So now you have started. Now you know what is systematic review. You know how, you know why you need to do it and how. So you have come with a topic, and you know where all to search. Okay, I've just given you a basic information. And now after you search, you have to plan. You don't know, it's just not writing and getting data, correct? So I will teach you how you have to plan your search information. So again, we will stick back to the same topic which I gave before. So in patients with COPD, does pursed-lip breathing as compared to regular breathing improve exercise endurance? So this is the topic which you have done. So this I will teach you how you have to use. Okay, so what we are going to do is I'm going to use the PICO formula which we did just before, how we have done it. The next is important is I will tell you how you have to do the search. Okay, so this is the planning which you have to do. So you have to have a plan, you have to have a table like this where you have to write down a concept or the techniques. Okay, that is one is P, that is whom you're going to do, COPD patients, your intervention, concepts, and what is the outcome you have written. Next, you should write down the keywords. It doesn't necessarily mean that COPD, if you type, you will get all that. So you should write down the keywords. You write down COPD, or you have to abbreviate it as common obstructive lung disease and all that. So that all has to be written for you to keep a record of the database searches. Okay, you have like I just give you another example is you are writing regular breathing. Regular breathing is what you have written, but many people would have written as like normal breathing could be another terminology. Okay, so in order to get that, you should have. And then I will show you what is mesh, which is part of your PubMed, which you start searching. And you have to limit when you're trying to get this data. You have to limit either by the time period. You cannot take for a very long period. Say, for example, I'm trying to take studies right from 2010 to 2020. That will be the time period, and the geographical region also. Now, again, when you're trying to do a study, you should have all these limits, because you'll have so many papers, you won't be able to analyze them. So you'll have to think, okay, I'm going to do this either in North India, South India, or India. It depends. Okay, or Gujarat alone. It all depends. So geographical area. Age group, what is the age group you're going to take? That is another important. So COPD, you're going to take early, like it's young adults or teenagers. What is, and language, if at all, if you're trying to do something. Okay, so this is the mesh to find out the words. Now, normally what happens is, actually, if time permits, and not this time, if there's another opportunity where I can share about how you can do a search, I will tell you all. Not everyone will use the same terminology for you to get. So these are the medical subject headings, which will give you synonyms of, this is a thesaurus, which will give you synonyms of these names, which you're trying to search, and you will try to extract the maximum. Okay, just to give you an example is I've written COPD. So it will read, when you search in this, it will read similar names like chronic, like pulmonary diseases also will be read there. Even asthma will be read there. So that is what it is for you to get the details when you use this. Then this is another common thing called as the Boolean operator, which everyone normally uses. I don't know how many of you all really understand and use it. Just give you example of two. Try to have this alone in your mind when you search. When you use and, okay, for example, we are trying to find out false and age. That is what we are trying to search in the database. So when you write and in this search engine, what happens is this will result, you will get the results of both terms of false and age together. That is what you will get. Okay, next is when you use false or age, this will either, you will have either which will be only false or aged, or both. You will get all this combined together when you search. Okay, and not just for the this is just to result will contain both, but not the third term, as whichever you want to ask. The reason why I'm giving you this is when you start searching, you should know when, because previously if you would seen, I would use back pain and exercise, and there's another, you can also do the same search as back pain or exercise. So by that you will be able to get different ideas which you can formulate. Okay, the next important is, now you are searching the databases and you've got, now what you have to do is you have to record these. So that is the most important. So first look at this table. I have divided into 4 parts. The first is date, on which date you're trying to search. The database name, I gave you, we saw EBSCO, we saw Medline, okay, St. Helen and all that. So those are the databases. And here the keyword strategies which we have used, it is like either we are using and or not, to narrow down to get, okay, based on the age range and all that, and the number of papers which you found, whether it is full text or just the abstract alone, you have to record. So this will give you an understanding of how much paper you have gone through and you have got. So this is the Pico worksheet. Okay, this is so far we saw Pico only for your selection of your topic, but Pico also has got a worksheet for your search strategy. I'll just give you an example how it is being done. We are starting. The first question is again the problem. So you write down the Pico, you find out the problem. Here the topic here is that is middle-aged male amputee suffering phantom pain. Okay, and this is a drug trial which they have done using gabapentin. So they are trying to see whether that gabapentin is used, and it is a comparison with placebo to see if there's a decrease or not. Okay, so that is the topic, is in middle-aged male amputee suffering phantom limb pain, is gabapentin compared to placebo effective or not? So the second question is, what type of problem is this? This is a medicine which has been given to see. So it's more of a therapy. Okay, so this you'll have to circle one for you to search protocol which you have to do. Okay, the third one is where all did you search this? So you have to see whether you have got it from publications out of meta-analysis or systematic review, RCTs, case studies, all that has to be included. Okay, and then based on this is the important point which everyone should look, that you should look for alternate terms. Okay, gabapentin is a drug name, it doesn't change, so that's not an issue. Other than that, you have phantom limb pain is one. You can have studies using phantom limb pain. There are others. The mesh would give you a better understanding of the other names, synonyms, like you have post amputation pain, post amputation pain. Even the spacing in between two words also will give you different results. So that is what I'm trying to tell you here. Then it is in men, man, male. This also will give you a difference. So you will have to make sure that you screen everything. Amputee is one you have studies. Other one is amputation you have. And coming on to the pain, it's just pain symptoms, and some studies might have neuropathic pain. So you have to make sure that you use the alternative terms when you try to do the study. Next is you have to write down on the search strategies. How are you going to state? So now for us, the first and foremost is the therapy which I used to use, gabapentin, which I've written, and phantom limb pain. Okay, you understand? So you're trying, when I taught you on the Boolean words, this is what it is. So you have written the therapy and phantom limb pain, and you've written or post amputation with the space, meaning that you will, when you search that in different databases, whoever is written in whichever way, those papers will come to your search. That is what you do. Same thing, and with men, male or man, all that you will have to do. Again, whenever you do, as I said before, you have to restrict your search on what is your, you have to zero down on your interest and the area. So here you are doing it on males. Again, the age group is 45 to 64, which you select, which you have to do. Then based on the years of publication, now you are trying to do a 15-year-old study. You are trying to see what is the effect, right, on the studies, all the RCTs, whatever publication has been done right from 2005 to 2019, and it is in English language which you select. And the minimum database, as I said, is at least 3. So Medline, Scopus, and you try to collect all these data. So by using this, you will get all the number of data you get. Okay, this is the eligibility. So now what happens is, the first and foremost, so we have come with a topic. We have used different search databases. We know how to tabulate the databases from the studies which we got. Now we have to see something called as the screening process, okay, for eligibility. So the first and foremost we see is the title. So we have to see whether the title is eligible, because based on the topic which we selected based on the PICO formula. If it is yes, you go to and you read the summary. If it is no, you exclude it. Okay, you read the abstract and see the abstract whether it meets our eligibility criteria which you are trying to do. If it is yes, you read the full text. Otherwise, you exclude it. You come to the full text, you see whether it includes all our eligibility criteria. Just to give you an example, the eligibility criteria is this: whether it is a male, patients aged between 45 to 64, the year of publication is between 2005 to 2019, it is in English, and all the strategies which you saw. Okay, so if it has everything, you will include that in the systematic review. You understand? If it is not, you will reject it or exclude it. Okay, so far I've been telling about a thing. I hope it is not confusing. Now we have come to the crux of today's presentation, that is called as the Prisma. As I told you, this is the protocol, this is the checklist. This is a 2015 checklist which is used for your systematic review. So the advantages of doing a systematic review is you have a preset protocol and you have to see whether everything falls into this. Otherwise, you can exclude them. It is unlike the other studies when you're doing a clinical trial where it is you have a lot of bias. Here also there are, but we will see how we can overcome. Again, what happens is you have a lot of headings in this. You have to see whether it falls into the checklist or not. To give you an example, title, whether you can identify or if there's an update in the title. Registration, whether we have registered in the Prospero. If you remember, I showed you 3 or 4 databases, places where you can register your systematic review, author's details, whether the introduction, methodology. Okay, so it gives you exactly a very rigid set of protocol for you to follow, the selection process, the data process. So in other words, what you're trying to do is you will be reading a already published paper, okay, under this protocol, and to see whether it matches or not. You understand? So that is what we are trying to do. We are not trying to do something new. Okay, we are trying to, but the process in which you are doing is a strict process where you have certain criteria you follow. You get all those papers and you see whether it all falls in this, and if it follows this Prisma protocol, this checklist, you accept them to do for your further analysis. Okay, so this is just to give you an example. Like normally what happens is when you start, okay, this is one of the studies which just roughly I did for y'all. That is to see the clinical and cost effectiveness of physiotherapy interventions following THR, okay, total hip replacement, a systematic review and a meta-analysis. So again, just to reiterate what I was sharing is like, again, PICO we have seen. Okay, so who's the population we are going to do is what? It's people after total hip replacement, correct? Okay, I is the intervention, water intervention, physiotherapy intervention is you're going to do. C is what is your comparison. You are going to compare this with normals, like without any physiotherapy intervention. O is your outcome. Who on whom are going to do? You are going to see outcome is you're going to see the cost effectiveness and the clinical and the cost effectiveness of physiotherapy. Fine. So with this, they have identified in all the databases. Okay. The N is the 1263. That's what I found out. In that 607 from Medline, Sinhelen, and the other databases. In that 181 were duplicates. Okay, it's that they are published in 2 databases, so they are being removed. So after removal, it was 1082. After 1082, now what has happened is you start doing. You see if there's any reason for potential citations for screening. That is like whether the eligibility criteria is correct and the other things. You start screening, and 1038 were excluded. That is based on the abstract and the full study. So based on that, only 44 full study were taken. Among the 44, only 20 were able to be synthesized or gone to do the meta-analysis and the entire, because the other reasons were the other, that is not physiotherapy. There were a lot of reasons for be excluded. So this is the process in which you do a systematic review. Okay. Now, what data should I collect when you start doing study? You might say that they would have had different data. So what should I take? So normally what data you should take is you should take data on the sample of the study which has been done, what intervention and what methods and source of bias, then outcomes and source of funding if possible. Okay. This again, this is just to reiterate the level of evidence, okay, which you have seen. The reason I'm showing you this is you will have to table it in this format. Okay, what is this formal? I'm just giving you a sample evidence based what you do. Okay, the first table is the year, okay, and the author. So what we are doing, this study is being done is on cognitive interventions. So they have used, this is Law et al. In the year 2014. That is the year you have written. So you have the second table is the level of evidence, okay, and the risk of bias. So the level of evidence are written as 1B, just for the understanding of people. This is the level of evidence which I showed. I show you the triangle, correct? So 1A is systematic review of homogeneous RCTs, okay. 1B is well-designed individual RTCs, okay, RCT, because with a smaller sample size. So that is how you classify them. 2A is systematic review of cohort. 2B is low quality RCT. 3A is systematic review of case control. 3B is again case control study. 4 is case series, and 5 is expert opinion. So based on this, the study, this Law et al. Is 1B, level 1B. It's an RCT, okay. Fine. Now this is the strength of evidence. Okay, this is another thing called as a strength of evidence. So you differentiate them as low, moderate, and strong. Okay, I will tell you what strong is. That is the description is 2 or more 1A and B studies. So we have seen 1A and 1B is all systematic review with higher end, isn't it? So RCT with larger number and the smaller number. That next one, moderate should be at least 1A and 1B, but the number size is small, okay. And low is, that is a low is few studies. There's a lot of flaw in the studies, so that also can be used. So based on that, I've written. So level of evidence is 1B. It is an RCT which has been done, and the risk of bias is moderate based on the table which has been given before. Then again, here participants and the inclusion criteria. So I write down the participants, number of participants that study was done, what was their inclusion criteria, and what was the intervention which they did. Again, what was the intervention, what exercise they did. Okay, so that is there was exercise, stretching and walking and cool down and all was done on one group. The other group received as active cognitive training. So these are the 2 trainings which were used. I would write down in this table. Next is the outcome measured. What are the outcomes measured? Was one is the neurobehavioral cognitive status and a trial making test, and this is based on a Chinese. So that's what I said. The language also is being used here. So outcome is the Chinese version, verbal learning test, which was being used, and IADL is being used, outcome. And what were the results? So the results showed that there was an improvement in the cognitive training group rather than the other group. So this is what it is. So what you have to do is, say for example, I showed you the previous slide, you have nearly 1200 or 1800 papers. You have skimmed that and brought it down based only on your eligibility criteria to 20 or 25 papers, correct? So the 25 papers you will have to write in a table like this. You understand? So each and every author you'll have to break up and write like this, and then you will have to tell your findings. Next is the risk of bias. Okay, so this is the we've come to the next part. Everyone knows about internal and external validity. I'm not going to do much about that. I will just give you as I said, that this has got a set of set of protocols to be followed. For risk of bias also, there are certain methods of doing it. One is called the Cochrane risk of bias, ROB. That is one way of doing it. Another one is the grade, okay, and direct coding method. Okay, so these are some of the biases which we normally know. I think everyone will be aware of the basic biases which we do: selection bias, performance, detection, attrition, and reporting bias. Okay, as the name denotes, how if there's any bias in selecting, performance, whether one group was different from the other, did something extra, detection, whether any, when you're able to find out, attrition, any dropouts, and reporting bias. So based on this, what we do is you will have to come out with a table. This is called of the risk of bias table. Okay, so initially I just want to quickly recap so far. I don't know how far it has gone into you all. Hope it is there. So you know what it is, and then why you have to do it, and how you did it. So you start off with the PICO formula. You get a topic out of your choice and run it in the different databases. You try to screen as per your criteria, and you write it down in the table which I said before. And this test also is part of your, what I said is your systematic review. Okay, risk of bias. After this only you will be able to publish it as a systematic review. Okay, so again, just to give you an example, this is a study which is being done. Okay, so again, when you see, there are 5 biases which is written. One is selection bias, performance bias, detection, attrition, and reporting bias. The last is overall risk of bias. Okay, this is what you do. So the first citation which you have taken is from Cooper et al, which I've done, and this again will give you, okay, the plus is to say is low bias, then the question mark is we are unclear of the bias, and minus is the high bias. You understand? That is how it is given. It is just like mathematics, they give you exactly what has to be done. So now what happens is, when I did the selection bias about the random sequencing, allocation, baseline, so you give it either a plus or a minus to say what it is. Performance bias also, that is blinding is being done, okay, of participants, of the personnel, that again that will give you. Coming on the detection bias, again blinding of the assessment and blinding of the objectives of the assessment, which the assessor is aware. That then attrition, whether all the data were completed by all the participants, reporting what was done. So you give them a plus or a minus or a question mark based on this. Okay, the scoring for this, they normally say is, the overall risk bias is if there are 0 to 3 minus, it is called as low bias. Okay, and 4 to 6 minus is called as a moderate bias, and 7 to 9 minus is called as a high bias. So whatever study you have taken previously, put on the other table to find out what studies and differentiation you did. Now for this, you are using this template to find out the risk of bias, RCT, non-RCT, and you find out. So this study has got just 1, 2, 3, 4 minuses. So it comes under a moderate bias. So I write down moderate bias. So based on this, you will conclude your study. Okay, so the risk of bias is not only for RCT, non-RCT, it is also done for public health studies. These are some of the names I've just given you. I'm not going into detail of all this. So again, this is called as Critical Appraisal Skill Program, a National Center for Social Research, and Cochrane Public Health Group. So these are some of the studies. Okay, so far we have done. So you have got the study. from the databases. You've got the data, you've written all the data, you know what has to be interpreted, you've run the bias if there's any bias, and you've got data on that also. Now you've got all this. Now the most important, disseminating. You have so much of data, you have done a study, how you write. So that is what they normally say. So now they say that I'll just give you some basic guidelines on how it has to be written. Narrative reviews, normally it's between 8,000 words to 40,000 words. Systematic review is less than 10,000 words. So when you look at the title, these are what I'm giving you is just it's not the main thing. This is just for your understanding when you start writing a paper, when you start writing a review article. So the function is, the title should be easy, that the patient, the person who reads should be able to understand. Okay, they always say. And the important is, this is what normally a publisher looks at when you start writing to them. Okay, so the tense plays an important role. They always say that the present tense, okay, is important when you're writing the topic, okay, title. And the title should be between 8 to 12 words. That's based on David's in 2005. That's what he said. The title should only be a question. You understand? So it cannot be an answer. So that is what. So whenever you write a review article, the topic should always be like a question. Okay. And the list of authors also should be given. Coming on to the abstract. When you write the abstract, everyone does. So when you write a narrative abstract, it will be a descriptive abstract, whereas the others, for systematic review and other reviews, you write an informative abstract. Those are the two types of abstracts which you see. So again, when you start writing, you should first start off with the objectives, 1 or 2 lines about it, then materials and methodology. Now, many people write abstract in just 1 paragraph without highlighting the subheadings. That's not the way to do it. So make sure you do it. So objectives, what you're going to do, materials and methods, what you are trying to do, just give a general picture, results in just few lines, conclusion. Okay, again they say when you start writing, again tense plays an important part. When you start writing, the objective should always be in present tense. Okay, the results in past tense, conclusion should be in present tense. Normally many people, we start writing is only in past tense. So you try to follow this. Objectives and conclusion should be in present tense. The reason is, when the reviewer sees your paper, or for the journal editor sees it, it should be something which is happening current now for him to publish, rather than giving him an already found out data in your past tense. And the normal length of the abstract should be 200 to maximum 250 words. Coming under the introduction, there actually everyone knows this, but I just summarize 3 parts. You have introduction, materials and methodology, results, conclusion, all that. So whenever you write that, you make sure that even this introduction also has an introduction, mid part, and 3 paragraphs. Okay, so normally they would say that you should write out the subject, general background of what you are writing. Then what is the problem? What are the trends? What are the gaps which you found out? And last paragraph should be justification, why you wanted to do this study. Clear? This is what it said. Again, it should be written only in present tense. Use as many citations as possible when you're trying to do. The length should be around 10 to 20% of the entire paper. You understand? If you're writing a paper for 15 pages, 2 pages should have introduction. That is what they mean. Okay. And again, as I said, that should have an introduction, body, and a conclusion. Coming on to the materials and methods, when you start writing, again, there is something many people lack when you start reading. Like I've been given opportunities to read through papers to see. There is no linking between 1 paragraph or one idea to the other. Linking between studies, that is the most important thing. The body and the method should be written only in present tense, which they say, and citations, which is normally needed. You cannot write one concept or one theory or one paragraph and another paragraph, another theory. Okay, so you make sure that there is a connection between these two, and the length is, this is the maximum. Your materials and methods would make up, say, about, I'm sticking again to the 10 page of your paper. 2 pages introduction means 5 pages of materials and methodology. You understand? So that should that should be there, and make sure that there is a connection between those ideas or the paragraphs which you start writing. Discussion and conclusion. Again, many people start writing this very nicely. Most the more common problem everyone does is they start discussing about their study. Okay, but the most important is you should find out the strength and weakness of your study, and then you should see the strength and weakness of another study which has already been published and try to see the similarities and the differences. That is what is a discussion. Don't just write down on, don't try to reiterate all what you wrote in your results and discussion, because no one wants to read your results again in your discussion. Okay, so you have to summarize, you understand, you have to summarize all your strengths and weaknesses of your study and compare it with in relation to other studies, and say what is the major differences which they were there in either the results and other thing. Again, this discussion and conclusion would stick to 1 or 1.5 pages to make sure. Okay, so I think with this, I've come to the more or less the end. I just have 2 slides to complete this. So today, the take home message, what I would like to share is like, I hope and I believe that many would like have had an understanding of what is systematic review. Okay, so that is just the synthesis and analysis of information, which has already been there. Why you need, there are a lot of papers which is coming, and no one has the time to read all those papers to come out with the best create a best best treatment. Okay, which is the best policy, or which is the best guidelines, and this is the highest level of evidence also. That is the reason. And then we see on the 4 P's in important P's which we need to remember when you're doing a systematic review. First P would be the Prospero. You have to register for systematic review. Second, using the PICO formula, you try to get the topic out of your choice, okay, and not based on your compulsion or your supervisor guides. Third one is Prisma. Okay, the topic, if you remember, the tabular column in which you reported, okay, for systematic review and meta-analysis. And then Pedro is the physical therapy evidence database. That is again based on your risk of bias, okay, to refer what it is. These are the 4 things which you need to do. And again, just to reiterate, we just saw as whenever you want to do a systematic review, you would start off with a clear definition, okay, and what you want to do. B is by following the research protocol. Okay, you can either follow Prisma protocol to get. C is comprehensive research strategies. As I said, unlike a review, the literature review, a systematic review is you will have to exhaust the entire database, all the databases to get your data, to get the studies which has been done. You just cannot search in one database and say that is a systematic review. Then do risk of bias, as I taught you, like whether it is a moderate risk, high risk, low risk. Okay, you have to have the tabular column, write down, and the interpretation based on the number of pluses and minus you get based on the different bias, types of bias which can occur. And last is your end reporting guidelines. Okay, so these are my references, and thank you. This is my email ID, just in case if you all want, if you have any questions to ask me, you can do so. Thank you. So I'll take this opportunity to thank people of Parallel University for this opportunity where I could share this, and hope to do more. Thank you so much.